The 5 physicians that you'll hear from today are specialists in different disciplines, and yet they treat a variety of conditions and diseases using similar surgical skills. Those skills include performing robotic-assisted surgeries, which are relatively new treatment options in the field of surgery.
We now live in possibly one of the most amazing times in the history of surgery, because the rapid evolution of computer technology has now allowed us to bring computers and robotics into the operating room, where they can extend the range of human capability and give surgeons the ability to perform surgical procedures in a minimally invasive computer-assisted fashion. That is something that was considered science fiction maybe just 20 years ago. So what you're going to hear from the rest of the speakers today is the amazing breadth of clinical activity that we offer here with the robot in London.
I had the privilege to be part of the team that did the first one in Canada. We did that at University Hospital in 2004. And subsequently have gone on, and I've personally done the most robotic prostate cancer surgeries in Canada, 360 to date. 100 years ago, with prostate cancer, we rarely were able to cure this disease. Even 25 years ago, prostate cancer was caught typically at an advanced phase. There have been several revolutions for the care of men with prostate cancer, but one I would argue that is the greatest thus far has been the introduction of robotic surgery.
The problem with many cancers is that, notwithstanding all the advice about reducing risk and watching lifestyle and seeing physicians, the truth of the matter is that cancer can happen to any one of us, and it does. And what's important as it relates to the robot is minimal pain and suffering for patients.
Head and neck cancer treatment's undergone some real changes. So up until about 2 decades ago, if you came in with a cancer of the tonsil or the back of the tongue, this is kind of what you got. This was standard of care. We would divide your mandible, do these radical neck dissections and take all sorts of tissue out. Unquestionably, this profoundly affected patients' speech and swallowing, and also their facial appearance. I mean, you think of some of the most things that you take most personally, your quality of life, your ability to eat, swallow, the way your face looks, is why this is a particularly devastating disease. Transoral robotic surgery has really emerged in the United States over the last 5 years or so as a minimally invasive way to treat these cancers. And so we see these patients when they've healed up, and they're essentially like normal people. They speak well, they swallow well, and in our first series of patients, we've carefully selected patients that did not have any spread to the lymph nodes in the neck, and they've completely avoided radiation, and they're all doing extremely well. And so for select patients, this really seems like the right thing to do.
The management of heart disease has evolved dramatically over the past 2 decades. The surgical treatment option must be tailored to each patient in order to optimize the benefits. Again, I emphasize that. Optimize the benefits and minimize the risk of detrimental effects. Robotic surgery has allowed us to do that. In the last quarter of the 20th century, surgery has been significantly shifted in terms of the way surgery is being performed. The invasiveness, as you've seen by all my colleagues talking about decreasing the invasiveness of surgery, we've been able to make surgery more acceptable with better results, fewer complications, and I think the most important thing is quicker return to functional health and productive lives. So this is an example of patients who undergo robotic surgery. Just as you see, 4 cold incisions. In women is extremely cosmetically appealing. They never see their scars. And this is a comparison where somebody has gone a midline incision where the breastbone has been cut compared to an individual who has gone, again, robotic, totally closed chest surgery. So in conclusion, thus far in our experience, robotic-assisted heart surgery is safe, effective, faster recovery. Preserved chest cavity stability, smaller incision results in reduced wound pain, reduced blood loss, less transfusions, earlier discharge from the hospital, and earlier return to routine activities.
I had an appointment at a leading hospital in Toronto to have my valve repaired. And I was booked within 2 weeks to have open heart surgery, which is normal with a valve repair. But what scared me was the fact that I was going to have my chest broken, and I didn't like that. So I Googled, and I found Dr. Kia. My surgery was successful. And Dr. Kia said to me, when you go home, you can do whatever you want to do. If it hurts, don't do it. Within a week, I was cooking. After 2 weeks, the grass was growing and no one to do it. So after, that was 2 weeks, 3 weeks, I cut the front grass with a push mower. After 4 weeks, my husband gave up and he allowed me to do my thing. And all I can say, if I had an open chest cavity heart surgery, I wouldn't have been able to do the things that I can do today.
We've run a little bit over time. There's a good reason for that. When you get a group of surgeons like this, myself included, who are so passionate about what we do and the opportunity to deal with this new technology, it's hard to shut us up, right? So we're going to go on about what really motivates us and what excites us. We have a robot. We've made immense use of it already at University Hospital. We have provided this host of world and Canadian firsts, and we have led the way as far as the rest of the country is concerned. Adopting this new technology now and getting this both for UH and Victoria Hospital is going to allow us to continue to push that frontier. So in this world, you can either be leaders or followers. London have been very much punching above our weight in terms of leading the way with computer-assisted minimally invasive surgery and this technology, both in terms of caring for our patients here in London, but also advancing quality of care across the country.